Hello students and welcome to session 1 of our PBL class this week. As you know, we are continuing with the cardiovascular module, but first let's see who's present with us today. So please raise your hand when I call your name. Sharifa?
Yes, here.
Sedan?
Here.
Amna?
Present.
Maryam?
Here.
Nawal?
Here.
Hiba?
Here.
Great. So it seems that we have a full house today. So who'd like to be the moderator this week then?
I'll be the moderator.
Great, Sharifa. And who wants to be the scribe?
I can be the scribe.
Amazing.
Please note that the facilitator is the overall coordinator who keeps the students on track and makes sure that everyone participates in the class. The moderator is the person that leads the discussion and makes sure that objectives are met. The scribe is the person that takes notes and helps to diagram the thought process. And last but not least, researchers are people who help answer questions during the discussion and present results to the class. And now one student is going to share their screen to display and read the case trigger to all the other students.
Okay, so I'll start by reading the case trigger. If you guys don't mind, I'll share my screen with you now. Just give me a few moments. Okay. Is the case trigger clear for everyone?
Yeah. Yes, it is.
Okay, let's read. Mrs. Fatma is a 35 years old Kuwaiti woman presented to the casualty with 3 months history of shortness of breath on effort on lying flat in bed. She also...
After the students have read the case trigger, they'll identify unfamiliar terms.
So then can you please share your screen so we can start with the unfamiliar words? Okay, 1 second.
Thank you, Sharifa.
Can you see my screen?
Yes, we can.
Yeah. Okay, so what are the unfamiliar terms for you girls?
For me, I'm not sure what syncope means.
Okay, then let's look it up.
I've just googled it, and it means temporary loss of consciousness due to a fall in blood pressure.
So may I interrupt here, please? Do you think the patient would have said the word syncope or something else? How do you think the patient would have described the symptom in real life?
Perhaps a fainting spell.
Correct. So, and perhaps the patient may have said, I felt dizzy and I fainted. So please go on. Thanks.
So how is that different from vertigo?
Good question.
Vertigo is a feeling that you or your surroundings are moving when there is no movement.
Okay, thank you, Amna. So any other unfamiliar terms?
Yes, dyspnea, which is basically shortness of breath.
Great. So anybody knows what shortness of breath during lying down is called?
I do. I think it's orthopnea.
Great. Thank you, Nawal.
The case trigger is now clear to everyone. So the next step will be to identify the cues, which are the words or sentences that give us clues and help us figure out what the issue is.
Let's move on. Write the cues.
For the age and gender, she's a 35 years old female.
She had a 3-month history of shortness of breath.
Continue, Sharifa.
Okay, so she has swollen ankles.
And also increased weight in the last 2 months.
She has no chest pain, no palpitations, no syncope, nor hypertension, and no diabetes, and she's not a smoker.
And she delivered her fourth child 4 months ago.
That's good.
We can also add that there is no family history of rheumatic fever or valvular heart disease.
You also look exhausted and out of breath.
Now moving on to problem formulation, in which the students will put the cues they identified into a simple sentence that describes the patient.
So now we can go on to problem formulation. Who wants to help us with the problem formulation?
I can. So I think the problem formulation is a 35-year-old female presented with shortness of breath on effort and while lying down, associated with swollen ankles and weight gain for 3 months.
Great, Nawal. So I think if you think of it, all of you guys, so if you think of it, any problem may be summarized in this formula actually. The patient, between brackets, age plus gender, plus chief complaint, plus the duration, between brackets, acute versus chronic. So this sums up the problem actually.
The students will now discuss each cue and its possible relations.
Okay, so since we are done with the problem formulation, let's discuss what happened to the patient. Why do you guys think this patient had swollen ankles, and how is that related to her weight?
Sharifa, can I interrupt here, please?
Sure.
I think this is a golden opportunity just to draw your attention that you may make use of the amazing library that we have at the Health Science Center, or even use your own e-library if you have one. So if you allow me, please, I want to share my screen to show you an example of an e-library. Can you see my screen? Yes? Great. So here's an example of an e-library. As you can see, a variety of books. I'm going to go ahead and choose the first one. This is a clinical medicine by Komar. And so you can, let me scroll down to the cardiovascular disease chapter. And here you go. You have a variety of learning resources and even videos. So why not take advantage of that? But be aware of the copyright issues. So I recommend that you restrict the sharing within the team itself. And thank you very much. I'm going to unshare now.
Thank you, Dr. Rilla.
Welcome.
So
Please go ahead. Let's continue.
Yeah.
That's good. So we were discussing the swollen ankles and how is that related to the weight gain?
Yeah. So I think the swollen ankle may be due to edema, which is the accumulation of fluid.
Yes, and this fluid can lead to the increase in weight.
Thank you so much. So also, I think the patient complained of shortness of breath on effort and when lying down. Can anyone explain that what that could mean?
Yes, I can. This could happen because of the fluid accumulation in the lungs.
Okay. And can I also interrupt again? So what about the ECG, girls? Can anyone elaborate on that? But let me say first that it helps that one knows the normal ECG rhythm first and know the different waves and what they indicate before delving into the abnormal. So can anyone talk about that?
Yeah, I can illustrate what a normal ECG rhythm looks like if you want.
Great. Yes, go ahead, please.
Okay, I'll just share my screen. 1 second. So can you see my screen?
Yes.
Yes,
Yes.
we can.
Okay. So first, I'm gonna start with the P wave. Okay. And then you have the PR segment, the QR and S complex, the ST segment, and then finally the T wave. Okay. So this is the PR segment and the ST segment. They are the flat lines in the ECG. Now I'm gonna label each one. This is the P wave, PR segment, the QRS complex, the ST segment, and finally the T wave. Now I'm gonna write what each wave reflects. So first, the T wave reflects the atrial depolarization.
Thank you, Sadan. That was amazing.
Okay, I'm gonna start showing my screen now.
Okay.
Thank you.
What do you guys expect to see in sinus tachycardia?
So in general, sinus tachycardia, the heart rhythm is faster than usual, so usually over 100 beats per minute. So I think this should appear as each P wave being followed by a QRS complex, and these complexes being narrow.
That's amazing, Nawal. Thank you again for your contribution. So let's move to something else now. So what does the absence of hypertension, diabetes, and smoking suggest in this case?
It probably suggests that ischemic heart disease is less likely in this case.
Yes, agree.
Okay, so what do you guys think this patient has from the discussion?
So the symptoms are suggestive of congestive heart failure. So probably the patient has congestive heart failure.
Yeah.
Okay.
I agree, especially that all the symptoms appears to be related to the fluid accumulation.
Now the students will come up with a hypothesis and identify the learning issues they need to discuss to prove it.
I think we are ready for the hypothesis.
One second, I'm just
Yeah, sure, Sadan, go on.
okay. Can you see my screen?
Yes, we can.
Yes.
Okay. So what's the hypothesis?
The case is suggestive of congestive heart failure.
Very good. I think we are done with the case. So we can move on to write the tasks. And I really think it would be great if you know about the types of heart failure.
Yes, and after learning about the anatomy and physiology of the heart, I think it's time to learn about the pathophysiology of the heart failure.
And also the causes and complications of congestive heart failure.
And the pharmacology of drugs used in congestive heart failure.
Okay, great. All of these are great suggestions. And just to complete the picture before ending the session, let me now read the other required tasks that you haven't mentioned already.
After session 1, the students will attend lectures and other sessions related to the PBL problem and will be simultaneously working on their tasks using the knowledge they gained in the lectures as well as external sources.
So welcome everybody, hello, and welcome to session 2 of this PBL case. Sharifa?
Hi, everyone.
Hi, Sharifa.
Hi Sharifa, how are you?
Okay, so let's discuss the tasks. Who's the first one? I think it would be great if we start the first one, the normal first. So yes, go on, Noel.
Yeah, so I'll start first because I'll be discussing the normal cardiac cycle. So let me just share my screen real quick. Okay, can you all see my screen?
Yes, I can.
Okay, great. So you can see the laser pointer as well?
Yes, we can.
All right, great. So I'll just start. So a single cycle of cardiac activity can be divided into two basic phases, diastole and systole. Diastole represents a period of time when the ventricles are relaxed. While
That's great, Nawal. Thanks so much. So
you.
who's next?
I'll go next. No one minds. I'll share my screen. Can you see my screen?
Yes.
Yes.
Okay, great. So I'll be discussing the definition and types of congestive heart failure. First of all, I want you guys to guess what's the definition of congestive heart failure from this picture.
I can guess.
Go
So I think congestive heart failure is kind of like what the name implies, like the heart fails to eject blood throughout the body.
Great. Congestive heart failure or heart failure occurs when the heart muscle doesn't pump blood as well as it should.
I think so. Then you are next.
Yeah, my task is about pharmacology.
Who's next?
Me. Okay. So my task is about pharmacology, specifically diuretics. 1 second, I'm gonna share my screen. Can you see my screen?
Yes.
Yes.
Okay. So as you can see, this is a picture of a nephron, but I'm going to need your help labeling the different types of diuretics and on which part of the nephron they act. So can anyone recall a type?
I think diuretics.
Okay. And on which part of the nephron do they act?
They actually act on the distal convoluted tubule.
So about here, right?
Yes.
Okay.
Correct.
Distal
I like that.
convoluted. Okay, and Medium, can you tell me what do they do?
They inhibit the sodium chloride transporter.
That's good. Okay. The sodium chloride. Okay, thank you, Mariam. So, can someone else mention another type?
Yes, I can. There's also loop diuretics.
Okay, and on which part of the nephron do they act?
I'm not really sure, but I think at the thick ascending limb of the loop of Henle.
So, about here, right?
Yes, exactly. You'll take all of this in the renal module, but since this is related, we might as well mention it now. Yes, go ahead.
Okay, and Amna, what do they do? Do you know?
Yes, they act at the sodium potassium chloride co-transporter, and there exactly they stop the reabsorption of sodium, potassium, and chloride. And this is achieved by competing for the chlorine binding site.
Okay, so let's go to the last presentation.
Yeah, that's me. Let me just share my screen. Can you all see my screen?
Yes.
Yes.
Okay, and the laser pointer?
Yes.
Okay, great, I'll start. So I'm going to be talking about the normal myocardium, which is pictured over here, and the hypertrophic myocardium, which is pictured over here, and I'm going to be comparing between the two. So hypertrophic cardiomyopathy is characterized by myocardial disarray. As you all can see, the fibers here are kind of going like all over.
After presenting the tasks, the students move on to read the clinical data and progress notes provided to them prior to the session.
I think we are done with the tasks. Thank you all. The presentations were very nice. We can now move on to the clinical data and case summary. Can someone read the clinical data for us, please?
Yes, sure, I can read it. You don't.
Thank you. Miriam.
Okay, so I'm gonna share my screen now. Just a second. Okay, can you guys see my screen?
Yes, we can.
Yeah.
Okay, so starting off with the patient history, Mrs. Fatma is a 35-year-old housewife who has been troubled for the last 3 months with disabling shortness of breath on minimal effort. She noticed that walking 10 meters on level ground is very difficult because she gets out of breath. She also described that when she lays flat in bed, she feels choked and acutely short of breath.
Thank you. So we also have an X-ray. So can anyone show us the X-ray, please?
Yes, sure, I can.
Thank you.
So before viewing the patient's X-rays, I wanted to show you a normal X-ray of a normal heart size. How to know if the heart size is normal? By finding the thoracic ratio, which is basically dividing the widest transverse diameter of the heart by the widest internal diameter of the rib cage. In adults, it's usually less than 50%. Here you can see our patient's X-ray. If you calculate the thoracic ratio, it's going to be 60%. So the patient is suffering from cardiomegaly, and also you can see that the patient is suffering from congested upper lung fields and also curly B lines.
What are curly B lines, Amna?
Okay, for the curly B lines, as you can see here, these are the curly B lines. Some students may wonder that also normal X-ray has lines, so how can I differentiate between these normal ones and the curly B lines? Curly B lines extend from the pleura and they go towards the hilum.
And finally, the case summary.
So I think now we are left with the case summary. If it's okay with you guys, I can read that. So
Yeah, of course.
Thank you. I'll share my screen. Okay, you should see my screen, right?
Yes.
Yes.
Okay, so here's the case summary. So the diagnosis, we have non-ischemic dilated cardiomyopathy, possibly due to postpartum or viral infections. Here I just would like to point out that in this case, the original disease is dilated cardiomyopathy, leading ultimately.
This is the end of this video demonstrating how to conduct a PBL session online. Hope you've enjoyed it, and thank you very much.